Welcome all our viewers to our live streaming series on Medela Singapore Facebook Live and Medela Malaysia Facebook Live. I'm your host, Shemaine. Remember that our live shows are streamed live on our Facebook page, mostly every Wednesday night from 8:30 to 9:30 p.m. Today, we're having a special guest on Saturday as this is her time available. So do like and follow us on our Medela Singapore Facebook page and Medela Malaysia Facebook page and Instagram to get updates of our live streaming series. So do like and share now to stand a chance to win this. So it's 3 Medela 150 ml bottles in a pack. So the the three winners we'll choose at random. So we'll announce the winners at the end of this series. So do like and share, and we'll announce the winners. We'll choose at random. We will also be having a quiz of 3 questions for this session's presentation. So we'll choose the fastest answer. So 3 winners will get to win this as well. So there's a Medela breast pump trial program at our PJ Service Center in KL as well. Pregnant mummies will be able to feel and look at how the freestyle and freestyle flex is. And currently breastfeeding mummies, you'll be able to try out the pumps. So do contact Medela Malaysia through our Facebook page, or you can WhatsApp, email, or call us to book your sessions. It's only limited to 2 appointments a day. So do get in touch with us if you would like to try out the freestyle and freestyle flex before you actually buy it. So I hope everyone is comfortable today. Hi, everyone. Yep. So we also have the promo on Shopee. So it's the Freestyle Flex promo. With this promo code, MEDEAPPLE, you'll be able to get the Freestyle Flex at 1999 ringgit with 3 free gifts. The Medela storage bottle 3-in-1, the one that we're giving away as prizes as well. The Medela Pureland nipple cream 7 gram, and also the ultra thin breast pads. So go and check out the promo on Shopee Malaysia. So is everyone here online now? Right. So joining me today is Miss Elpeni Ramli, staff nurse and lactation educator. Miss Elpeni Ramli was trained at KPJ International College of Nursing in 2010. She has special interest in breastfeeding and now works as a lactation educator in one of our prestigious private hospitals in Kuala Lumpur since 2015, sorry. She was conducting parent craft programs for parents and also conducting breastfeeding trainings for the hospital staff. Her experience with breastfeeding her 2 daughters always helped her to manage and handle her patients as well, who come for breastfeeding advice. She also actively involved with breastfeeding events and programs in the country. So today we're going to talk about how to start breastfeeding. So let me introduce and welcome online Miss Elpeni Ramli. Hi,
Hi,
Miss Elpeni.
yes, Ashwini.
Hi,
Afternoon.
good afternoon. Thank you so much for taking your time out to join us today.
Yep.
Yep. So I'd like to say that if any of you have any questions or comments during the session, please feel free to leave a comment and we'll try to address it along the way. Right?
All right.
So, Stephanie, over to you.
All right. Thank you so much, Yamin. All right. So, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And a very good afternoon. Thank you so much to those mother to be and parents who joining our session today. So I hope that before we start further, please share this video so that more mother will benefit from our sharing today. Okay. So I will open my slide. So our today topic is what to expect in the early day of breastfeeding. Okay, so I know there's a lot of mother out there. They thought that breastfeeding will come in natural way, means that they just open their clothes, put the baby there, and the baby will know how they need to feed from the breast. Okay, basically it won't happen. If you are very lucky enough, you will experience that. But most of the time, mother or mother to be out there, you need to make sure that you have a little bit of knowledge and some basic on how to breastfeed your baby to make sure that you can breastfeed your baby more smoothly, more successfully later in your journey. So today we will share, and I will share a few tips and some guideline to make sure that you able to breastfeed your baby better later in your journey. Okay, so like Shamin explained just now, okay, my name is Elpeni Ramli. I'm the lactation educator, staff nurse in the maternity ward since 2015, and have experienced breastfeeding my two kids as well. So basically, all the sharing today is based on my experience as a lactation educator in the hospital that working in maternity ward, and as long as my own experience as a breastfeeding mother. So if you do have anything that you want to ask along the discussion, you can just drop by your question, and I hope that I have a time to answer all the questions that given by all the parents out there. All right, so don't forget, share, tag all your friends so that more mother will benefit from the sharing today. Okay, so basically, okay, very first question that I always ask my patient is, or a mother that come and see me, is how long you want to breastfeed your baby. So before you start your milestone, at least you have the idea on how long you want to breastfeed your baby. So according to WHO and Malaysian breastfeeding policy, all mother are encouraged to feed their baby only with breast milk for the first 6 months of the baby's life, and they can continue up to 2 years. Okay, so once your baby 6 month old, which is actually 180 days, you need to start uh, complementary food to your baby, and you can continue up to 2 years. So for the first 6 months of your baby's life, your baby just need your milk. Okay, so when I mention about only milk, means that no water, no other food, or no other supplement unless by doctor order. All right, so this is what you need to do. Before you start, you need to know first how long you need to breastfeed your baby. So the first 6 months, we are encouraging mother to exclusively breastfeed their baby with only their breast milk. So how you want to breastfeed your baby? So this is the thing that we will learn today. This is the tips that I will share to all the mother out there, so that you have some guideline on what you need to prepare, what you need to do when you have your baby with you later. Okay. All right, so the first tip that I want to share is breast milk come in 3 stage. Okay, there's a lot of mother, they always think that they don't have milk. Why they thought that they don't have milk? Because when they squeeze their breast, okay, there's nothing come out. Okay, when they feel their breast, they feel that there's nothing inside. Okay, so before you start your journey, you need to understand first, when we start producing milk, what milk that you have, and either the milk is enough or not for your baby. All right, so this is basically the anatomy of a pregnant woman. Okay, during the pregnancy, your breast have some changes. There's a changes happen inside your breast because of the hormone that you are producing when you are pregnant. Okay, and these all these hormones also help to produce milk. Okay, you can see from the picture on my slide. Okay, most of your milk factory, I call that as a milk gland. Actually, the thing that I circle is a milk gland. Okay, a group of your milk gland. You have a billion milk gland in your breast, actually alveoli, you call that as alveoli, that producing milk. Okay, and when you start producing milk, okay, according to American Academy of Pediatric, okay, all mothers start produce milk on their second trimester. Okay, so all pregnant women will start producing their first milk that we call colostrum on the second trimester of your pregnancy. So what will happen? Okay, during your second trimester, I'm very sure most of the mother, you might experience that your bra is getting tighter. You don't feel comfortable to wear your old bra. Okay, it shows that your breast having some changes, and actually the pregnancy already get ready the breast for the breastfeeding. Okay, so what you need to do next is to just add on all the information to know either when the baby is sucking from the breast, the baby is getting the milk or not. All right. So basically, you will start producing the colostrum. The first few day milk, basically in day one, day two, you will only produce colostrum. You won't have a lot of colostrum. Okay, this is why mother always thought that they don't have milk, but actually they have a small amount of colostrum that enough for the baby requirement. Okay, and colostrum, the texture is very sticky. Okay, it's very sticky, it's very concentrated. I always ask a mother who just delivered to just feel the texture of the colostrum, and most of the mother will tell me the texture of the colostrum is just like an oil. Okay, it's very sticky. So you don't have a lot, but you will have enough of colostrum that baby required after the delivery. Okay, so from the colostrum, your milk will change into transitional milk. Okay, you can see the transitional milk, the color is just like the mixture of orange juice and milk. Okay, you won't have your milk color milk, the white color milk, by day 3 to day 5 after the delivery. Okay, you can still see a little bit yellowish but more diluted milk by day 3 to 5 after you deliver your baby, and you will only have your mature milk, the milk color milk, by day 10 or on the second week of your delivery. Okay, so don't feel sad. Okay, when you press your breast, you feel that nothing is inside, or when you squeeze, okay, there's nothing much come out. Okay, don't feel sad on that, because trust your body, trust yourself. You just imagine a newborn baby who just delivered, who are still learning on how to swallow, on how to go and suckle from the breast. Okay, you just imagine if in day one you already have plenty of milk in your breast, and the poor little baby is learning on how to drink and how to swallow. Okay, it must be a very difficult time to a baby to drink a lot of milk when they are still learning. Okay, so trust your body. Okay, you will produce accordingly. So you can see the changes, okay, from a very yellowish color of colostrum, which is very thick basically, to a milk color milk. Okay, within the first 1-2 weeks you can see the changes of the milk. Okay, how to make sure that the baby can get the colostrum and the baby get the protection so that you can breastfeed the baby better. Okay, please, okay, make sure before you deliver your baby, okay, discuss with your doctors or midwife that you want to practice or you want to do the skin to skin contact straight away after the delivery. But you need to make sure for you to do the skin to skin contact, the baby need to be in a stable status. Okay, means that the baby is fine, everything is good, the APGAR score is good, is well. So you can just request straight away after the delivery, the midwife or the doctor put your baby skin to skin on you. Okay, so why skin to skin is very important? We call skin to skin, okay, because the first 1 hour after the delivery, okay, the first 1 hour after delivery, we call that as a golden hour. Okay, during this golden hour phase, okay, when you put the baby skin to skin on you, it's not only will help you to make more breast milk because the baby will get all the colostrum during that skin to skin process. You also will stabilize baby heart rate and temperature. You just imagine when your babies come out, is in the aircon, room. Okay, so when the nurse or the midwife put your baby on your chest, okay, you will seal your baby with your body temperature. Your baby will cry less. You also will feel better. It also will divert your mind from the pain. So other than for breastfeeding's benefit, skin to skin contact is also very good for you and your baby. All right, so to make sure that the baby get the colostrum, and to make sure that you can have more milk, and to make sure that your milk will transit well from colostrum to the transitional milk to your mature milk, please do skin to skin if possible, okay, with your baby in the labor room itself for the first 1 hour after the delivery. Okay, so tips number 2. All right, so you need to make sure, all right, you finding the right position for you and your baby. Okay, breastfeeding is not basically about putting the baby on the breast and the baby will crawl and feed. Okay, that what will happen, but at least you know what is the correct position. Okay, what is the best position that work better for you and your baby as well. Okay, breastfeeding is all about technique actually. Okay, technique on how to hold the baby, the technique on how to make sure the baby can open wider to feed on the breast. Okay, all the technique, at least you have some idea so you know what to do when you have your baby later. Okay, choosing a breastfeeding position might take a few attempts, okay, for you to practice and for you to choose with you and your baby to know which position is working well for you and your baby. So you cannot ask your friends what you do when you feed your baby, what is the position. Maybe that position that your friends are doing with their baby is not comfortable for you. So you and your baby is the best person to decide which position that is the best for you and your baby. All right. So basically, okay, now I will show some tips, okay, on how you can position the baby correctly on the breast. Okay, okay, maybe admin can just come out from the slide. So I need to share on how to position a baby. Okay, using my baby now here. All right, all right. So basically, when you want to breastfeed your baby, okay, there's a 4 important tip that you need to remember. All right. So before that, I will just close my screen. All right. Okay. So to position your baby well, there's a 4 important tip that you need to know. All right, so that position for me is very crucial. If you position your baby well, you will do the attachment. This is the next tip that I will share. Okay, basically today we will share 3 important tip in breastfeeding as well. The technique, the 3 important technique. First one is how to position the baby. Second one on how to make sure that the baby can open wide enough so that the baby can have a good and deeper attachment on the breast. And the third technique is how to unlatch the baby if you know that the baby doesn't fit well on the breast, or if you know that the breastfeeding is hurting you. Okay, so basically now I will share 4 important tips. So if you are watching this session, if you are having this sharing with your husband with you and you are pregnant, okay, you need to make sure that your husband remember these 4 tips, okay? Because as a pregnant mother, you might forgot a lot of things after the delivery. Okay, first thing, whenever you hold your baby, whichever position that you want to do, later we will share what position that you can do with your baby. You need to make sure that the whole body of your baby is facing you. All right, the whole body need to facing you. Okay, all right, so you need to make sure that the whole body, okay, I will show you in this position, is facing you. Your baby's face will facing your breast, and your baby's body will forcing your tummy and your body actually. Okay, because most of the time when I go and do a walk round and I look on the mother on how they position their baby, most of the baby just turn the head toward the breast, but the body is facing upward. So it's not comfortable for your baby. Remember that. You just imagine, okay, if I'm doing a class, I'm doing a parent class as well for a breastfeeding mother. So basically, I will ask them to just turn their head to the side and swallow your saliva. It's not comfortable, right? So this is what your babies experience when you are doing like this. So you need to make sure that the whole body is facing you. Okay, that is the first tips on how you can do a good position. The whole body of your baby, you can always support the baby's head and shoulder and support the baby's buttock, and you can just turn the baby towards you so that the face facing your breast. So I will do this okay in this position. Okay, so this is how. Okay, you just imagine there's you are here, all right? The face facing the breast. Okay, the face will facing the breast, and the tummy of your baby will facing your body. Okay, that is a first tip. All right, you need to make sure that the baby is facing you. Okay, tip number 2, you need to make sure this is for newborn. You are support the whole body. You support your baby's well, the whole body. You need to make sure that you put your hand on the baby's lower buttock or center of your baby's buttock. Okay, lower buttocks or center of your baby's buttock while you are putting the head on the crook of your hand. Okay, you need to support the babies well. You need to support their spine. A newborn baby, they are very soft. All right, so first tip, turn, support, and you need to make sure that the baby is closer to you. All right, so always remember, baby to boobs, not boobs to the baby, because most of the mother, they tend to lean forward to their baby, which is actually is not comfortable for baby and mommy as well. So you need to make sure facing, support, the baby is closer to you, all right? And you need to make sure that the baby's ears, elbow, and buttocks is in line. Okay, 4 tips, okay? Facing, support, closer, all right, closer to mommy, not breast to baby, baby to breast, and you need to make sure that the baby is in line. Okay, this is 4 important tip for position. Okay, basically today we cannot discuss so much on the position, or else we don't have time to discuss more tips, because basically today I will share 8 tips, okay, on how you can start your breastfeeding better. Okay, on how you can start your breastfeeding with a smoothly letter, with all the idea that you already have. So mommy out there, please learn more about how to um, how to position the baby well on the breast. Okay, so this is all the position that you can try with your baby. I'm always encourage, okay, in the what I always advise, especially new mother, to try a laid back breastfeeding position, because this is very natural, less effort. Okay, the gravity will help you a lot. And I also encourage them to do a cross cradle, because you are in control. All right. You also can do a football hole. The baby will be underneath your armpit. Okay, this is how a rugby player hold their ball. This is not the Malaysian football or Singaporean football. Okay, this is American football. The rugby player hold their ball. Okay, they will put it under their armpit. This is especially for those who are come back from who go through a cesarean section. You can just try this position, and I love this position, side lying. Okay, because in this position you can feed the baby and you can rest at the same time. Okay, so which position that works better for you and your baby, you are the best person to decide it later. But always ask this question whenever you feed your baby or whenever you position your baby. Am I relaxed? Am I comfortable? Are my back and shoulder support? Because breastfeeding will take time. So you need to make sure that you are relaxed and you are in a comfortable position before you continue your feeding. Okay? And is my baby well support? This is all the 4 tips that I shared just now. Okay? With all the tips, with all the questions that you ask yourself, okay, basically breastfeeding position will getting better, because most of the mother did not even know how to hold their baby. They don't even know where to put their hand. Okay, because they thought that breastfeeding will come naturally. Okay, they thought that okay, baby will know how to feed. Okay, the baby will know how to feed because baby born with that reflex. The suckling reflex born with the baby. But as a parent, as a mother, you need to guide your baby on how to make sure that the baby can transfer optimum milk from your breast. Okay, so now our third tips. Okay, our third my third point today. You need to make sure getting the latch take practice. Okay, practice and practice and practice. Okay, you need to you don't feel bad or you don't feel sad if you try to latch the baby for the first few time and the attempt is fail. Okay, so it's take time for you to guide your baby or for you to let the baby sucking correctly. Okay, we basically call that as a suckle. Sucking and swallowing is suckle. Okay, suckling correctly for on the breast. Okay, so to make sure that the baby is sucking correctly on the breast, you need to make sure, all right, the baby are suckling from the areola, not only from the nipple. Okay, because nipple doesn't produce milk. Our milk factory will be behind the areola. Okay, this is all the large drain that transfer milk from the breast will be in the breast. Okay, so you need to make sure that the baby is suckled from the areola itself. Okay, basically I will teach mother, I will ask mother to just divide your areola and the nipple into three area. One, two, three. So you need to make sure that 2/3 of the lower half of the areola will be in the baby's mouth. Okay, to make sure that you can do that, you need to aim your nipple or you need to make sure your nipple will be on the same level of your baby upper lips or on the baby's nose. Okay, you cannot just straightway aim at the center of the baby's mouth. Okay, you need to aim on the upper lip of your baby. So wait for the baby to launch big mouth and you bring the baby to the breast. Remember, don't push your baby's head or the baby's neck. You bring their shoulder near to you. Okay, so that they have a good and deep attachment. Okay, so to make sure that you can attach the baby well as well, you need to know, you need to make sure that you hold your breast correctly. Either you hold it C hole, okay, C hole. Okay, it's just like you are holding a bottle and you remove the bottle. Okay, C hole or from down a U hole. Okay, you can read more about sandwich position. Okay, it's just like when you want to eat sandwich or you want to eat a burger. Okay, you need to compress it, all right, so that you can eat it better. So this also comply with breastfeeding. Okay, our breast is very round. To make sure that the baby can attach well on the breast, you need to support the breast. Okay, some mother really need to support their breast to initiate the breastfeeding, but some mother no need to do that. So you see first. That's the reason why I did mention earlier just now. Okay, it's take practice. Okay, it's take practice for you to do it better with your baby. All right. All right, so suckling and sucking are different. Okay, sucking is just like okay, and suckling is the mechanism of sucking and swallowing. Okay, all right, so you need to always remember, okay, whenever the baby have a good attachment, a deeper latch on the breast, the baby not supposed to hurt you. The baby not supposed to crack your nipple. The baby not supposed to make you in pain. All right. A good and deeper attachment, you might only feel a tugging and pulling sensation. Okay. So whenever you feel pain, when the baby are suckle on the breast, you know the position is correct, but you still having the pain because of the attachment. Okay. Most of the mother, they love their baby so much. All right, so when they have the pain, they will just like, it's okay, I can bear the pain. Okay, just let the baby drink. So they will hold and bear the pain for 1 hour. But when they put the baby down, the baby start crying again. So they feel so frustrated and they feel so stressed. Okay, so remember this: you love your baby, but you need to love yourself more. Okay, whenever you feel pain or the baby is hurting you, there's something there that you need to look back. Okay, especially the position and the attachment. So whenever you feel pain, when your baby is sucking on the breast, what you need to do is you need to unlatch the baby. So how to unlatch your baby? All right. So use a power of your little finger. Okay, you cannot just simply pull the baby's head away from the breast. You cannot just simply, all right. Maybe the position, the attachment doesn't hurt you, but the unlatching will hurt the nipple. Okay, because the vacuum is very strong. Okay, some part of the areola is already in, right? So if you feel pain when the baby is start suckling on the breast, okay, and you just wait, you just try to adjust. But if after 30 seconds to 1 minute the pain is still there, unlatch your baby from the breast. So how to unlatch? You can always use the power of your little finger. Okay, so how to unlatch? You can just go to the tip of the baby's mouth, and just press down your areola down. Okay, you go to the tips and press down to break the seal. Okay, to unbreak, to just break the suction, and you can just unlatch the baby and try back the attachment by same, aim the nipple on the nose and the upper lips, wait the baby for a big mouth, all right, to open bigger mouth and bring the baby to the breast. Okay, so keep practice. Okay, number one, a good position. Number two, a good attachment. And number three, if the feeding is hurting you, unlatch and try to practice again a good attachment. All right, so number four, the tip number four, okay, that you need to know, right? Nursing a new arrival can be a full-time job. Okay, you need to bear this in your mind. Breastfeeding will be a bit tiring, but it's only for the first 1 2 weeks of the baby's life. We need to be fair with our newborn baby, all right? Because they didn't know what is day and night. Okay, so you cannot blame the baby. So I always tell my patients, I always tell a new mother, when you have your baby, they are a new king and new queen of the house. All right, so you need to make sure that you have enough rest, and you need to make sure that you know how to manage your time with your baby, because a newborn baby will feed roughly 8 to 12 times in 24 hours. Okay, 8 to 12 times in 24 hours. So if you it's very commonly you might listen to these words, very common. You need to feed your baby on demand. So how you know that you are feeding the babies on demand? Okay, it's supposed to be 8 to 12 times in 24 hours, and you are feeding your babies according to your baby signal, according to your baby cues, not according to the clock or depending 100% on the baby's cry. Okay, because the only way baby communicate with us is by crying. All right, so baby will cry for dirty diapers. Baby will cry for a gas in their tummy. Baby will cry because they just want some cuddle from you. So you need to know why your baby's crying. Okay? It will take some time for you to understand your baby's behavior, but breastfeeding on cues is very helpful, so that you can feed the baby before the baby start crying. Because if you can see from the slide, this is already a late cues where your baby is already hungry. Your baby is hungry and angry. So when you try to feed a hungry baby, what will happen? The baby will just push away your breast. The baby will cry more. All right. So you need to make sure whenever you try to feed a crying baby, calm down the baby first before you start the offering your breast again. Okay. So remember, it might be a full-time job. All right. But you can just have rest in between the feeding. Is 8 to 12 times in 24 hours, and you need to feed the baby day and night. Okay, to make sure that you have plenty of milk, to make sure that you are feeding the baby successfully, to make sure that you have enough milk for the baby's later. Okay, so tip number 5 that you need to know as a breastfeeding mother. Okay, breastfeeding should not be painful. Okay, there's a few complications that you will experience throughout your journey if you do not breastfeed your babies well. Okay, if you do not position the baby correctly, if you doesn't empty your breast after the feeding, okay, there's a lot of complication will come. Okay, there's a lot of complication will be in your journey later. So it's very important for you to get started breastfeeding with a good knowledge and with a good guidance, so that you won't experience all this later in your journey. So this is a very common breastfeeding issue that mother will face throughout their journey, but all this actually is preventable. Okay, if you know how to prevent it, you won't experience this. Okay, so a very common is crack and sore nipple. Okay, basically crack and sore nipple happen because baby are not deeply attached on the breast. Means the baby is only sucking at the tip of the nipple. Okay, if the baby is only sucking at the tip of the nipple, the friction between the baby's tongue and the baby's gum will hurt and saw your nipple. So to make sure that you doesn't experience this, you need to aim for a deeper latch. Okay, so always remember, whenever you feed the baby's chin need to touch your breast first. Okay, the baby wait for the baby to open wide enough, and the baby is suckled on the areola as well, not only from the nipple. Okay, so in case you already experience crack and sore nipple, what you can do? Okay, number one, you need to check back and correct. And you can also apply any nipple cream that's safe for breastfeeding. There's a lot of nipple cream out there that you can apply, or mommy also can apply their own breast milk. Okay, on the breast to make sure that you feel the cracked nipple better. Okay, so another very common problem that mother encounter during breastfeeding is breast engorgement. So what is breast engorgement? Breast engorgement means that you always feel that the breast is full with milk. Is the milk there cannot come out. It's hard. It's full. So basically, all this happen because you are not feeding the babies on demand. Okay, or you are not emptying the breast every time you feed the baby. So all this can be prevented by a good attachment and positioning by the baby actually. So not enough milk, it always happen later. Okay, not at the beginning of your journey. It's always happen later. If you always keep your breast engorged, you always make your breast full. Okay, you always make the breast full. What will happen? Your breast will start sending a signal to your brain, produce less milk. So this is why, okay, mother with common with mother always experience engorgement will having not enough milk issue as well later in their journey. Okay, and block that also happen because of the wrong attachment and a wrong technique of breastfeeding. Okay, all right, so tip number 6. All right, don't get overly anxious about your milk supply. Okay, because most of the mother, even before they start their journey, they already have the mindset, oh, I don't have milk because my mother cannot breastfeed the baby, because my mother doesn't breastfeed, my sister doesn't breastfeed the baby. So I'm not sure is either I'm having enough or not. Okay, so like I mentioned earlier in our discussion, during your pregnancy on the second trimester, you already have your milk. So now what you need to do is just let the baby drink on the breast, work with your baby, and do it together to have more milk. Okay, do it together with your baby, do whatever that you can do to have more milk. But at the same time, you need to make sure you have the idea on how you know whenever the baby is sucking from the breast, even the colostrum is not so much, but it's enough. Okay, so you need to always learn about the sign of babies getting enough milk. Okay, so basically, breastfeeding baby will feed 8 to 12 times a day, and when you have more milk, you can hear your baby swallowing the milk. You can always look and check your baby pee and poo. Okay, because it's very logic. If the input is enough, the baby will pee and poo very well. The baby looks satisfied and alert. The baby have a good muscle and skin tone. You can just look at the baby's skin is moist, is not look dry. Okay, and basically after 5 days or after 7 days, you start to feel that the breast feel full before the feeding and feel lighter after the feeding. You won't experience this on the first few days, but you will experience this later. And your baby also will have a very good weight gain. Okay, so but you need to have you need to know this. Okay, a newborn baby, they will lose 5 to 10% of the birth weight for the first 2 weeks of their life. Okay, the first 10 to 14 days of their life. Okay, so it's very common. Okay, if you deliver a 3 kilo baby, and when you bring your baby for the first checkup after 7 days, the baby might lose their birth weight. So don't feel sad and start blaming your milk. Okay, it's very common. Okay, baby will excrete all the excessive fluid from their body for the first 7 days of their life, and they will gain back the birth weight. They are supposed to gain back their birth weight after 2 weeks. Okay, so a good weight gain to know whether the baby is getting enough. Basically, you can start monitor the baby's weight gain after 2 weeks. Okay, you can also look for this template in in the internet, okay, which is very helpful on how many dirty diapers that you need to see from the baby, what is the color. Okay, this is all very good information, but I just want to share, okay, the color of your baby poo will change, okay. Once you deliver a baby, a first day old baby, they will pass a very black color poo. Okay, actually it's greenish black. Okay, and it's not the sign that the baby is not getting enough. Okay, this is what we call meconium. Okay, and the color of meconium is dark green. So don't be surprised when you go home in day 1 or day 2. Okay, you open the diapers and you see a black poo there. It's very common. Okay, how you know that the poo indicate that the baby is getting enough or not? Okay, you need to see the changes of the color. Okay, in day 1, day 2 is a little black or dark green. Okay, by day 4 it's supposed to be lighter green, and before 7 days it's supposed to be yellow color, mustard color, or in Malaysia you can just compare it into a dull color. Okay, that is the color of your baby poo that indicate either your baby is getting enough or not. And the pee, you need to see the frequency of the pee, like we mentioned earlier. Okay, so tip number 7. Okay, how you know what you can do to make sure that you can feed your baby well. You need to always understand this. I did mention just now, you need to love yourself first so that you can love your baby better. A well-fed mama means a well-fed baby. Okay, why I highlight this point, because most of the mother, especially a first time mother, okay, when they feel thirsty and the baby start crying, they will just ignore themselves. Okay, they will start feed the baby even they feel thirsty. All right, when they feel hungry, again the food is there, but because the baby is crying, they will just left their meal and start feed the baby. So don't do that. Okay, be selfish. Okay, you need to love yourself. You feel thirsty, you drink water first. Okay, you just need someone to. You won't take so long to drink a water, right? You feel hungry and the food is already there. Eat something. I don't ask you to finish the whole meal. Just eat a little bit so that you have some energies to feed your baby. All right, so you can focus better when you are well. Okay. So to make sure that you are well and you have a good, you are fit to feed your baby, you need to drink enough. Okay. Basically, they will encourage breastfeeding mother to drink 2 to 3 liters per day. Okay, more than 8 glasses. So, but drinking issue also very important for me to highlight, because some mother they thought that they need to drink a lot and they start to drink the whole bottle of the 1.5 liter water at one time. So what will happen next? She will spend most of the time in the toilet to passing urine. Okay, so you need to drink a little bit but frequent. Okay, 1 glass every 2 hours. All right. So when basically I will just advise my patient, just get 1 glass of water before you start feeding, and 1 glass after you finish your feeding, or in between if you feel thirsty you can get another glass of water. Okay, how you know that either you are drinking enough or not? You can always look at your pee color. Okay, mummy pee color. You can always look at your pee color. If your pee color look very dark, concentrated yellow, so you know that you are not hydrated well, so you drink more. Okay, so any kind of liquid, actually it's not necessary plain water. Okay, and some cultural or some taboos, okay, from Malays, for example, we cannot drink a lot. Okay, so or for Chinese, okay, they only drink their hon chow. Okay, their red dates. Okay, so a variety of fluids to make sure that you have enough liquid in your body, so that you can produce enough milk for your baby. All right, if someone in the house very particular, very concerned about consumption of water, you can always ask them to put to cook something that soupy. All right, so you can eat more soup, so to make sure that you are getting enough liquid as well. So you need to make sure that you eat a balanced diet. Okay, you need 3 serving of protein, 5 serving of calcium, 3 serving of whole grain, and 5 to 6 serving of fruit and vegetable daily. Okay, this is a very basics food intake that breastfeeding mother can eat throughout their breastfeeding journey. All right, so and just don't skip your prenatal vitamin. Most of the doctor will ask you to continue taking your maternal or prenatal vitamin as long as you are feeding the baby. Okay, to make sure that you have all the nutrition that you need and you during the breastfeeding itself. Okay, so now we will go into our eighth eighth tip today. The last tip today, you need to get the support that you need. Okay, don't feel ashamed if this is your third baby but you still don't have the idea, and if you still not remember how to hold your baby correctly. Don't feel bad if you don't know how to feed the babies well, but your sister, your friends are doing it well. Okay, support is very very important in your journey. What you need to do now, if you are a pregnant mother, share your intention of breastfeeding your baby with your partner, with your husband. Okay, share why you want to breastfeed your baby with everyone in the house, so that they understand why you want to start breastfeeding, and then they will support you throughout your journey as well. Okay, so get a good support is very important, especially from our husband, to make sure that your journey will become smoothly. You can successfully breastfeed your baby happily. Okay, get a good circle. Okay, if you are a working mother, start to find out what the support that you can have at your working place. If you're a housewife, okay, get the support from your husband. Tell your husband why you want to breastfeed. Okay, I always encourage, even me myself, I will write down, okay, why I want to breastfeed my baby. All right, why I want to breastfeed my baby, I will write down, and so I know why I want to do that. Okay, you can always support yourself as and get a good support around you as well. Okay, so if you're having trouble breastfeeding, okay, in Malaysia, okay, actually there's a lot of lactation consultant, and there's a lot of lactation counselor that available, okay, that can help you. Actually, they are very nearby, they just around you. All right, you just need to know how to get help from them. Okay, and most of the hospital, baby friendly hospital in Malaysia, they have their own lactation unit. What you can do is just ask if you do need help from them. Okay, most of the clinic kesihatan, they also have their lactation unit support group that you can just ask if you do need help from them. Okay, and there's also a counselor can do with it. Okay, I just shared some of the web that you can just go through, so that you can ask for help. If you do need help throughout your journey, you can just visit www.permatasuswan.com. All right, this is a platform where most of the counselor is there all over Malaysia. If you do need help, you just register yourself there, and then they will assign a counselor, a certified counselor, to come and visit you at home. And there's a lot of breastfeeding support group as well. I just put some. Okay, there's a Feed by Mama, there's a Happy Breastfeeding Malaysia, the Breastfeeding Advocate Networking. All right, basically, this support group is very helpful, because sometimes as a mother who are feeding your baby, even you have a very good support from your husband, you might think that, okay, my husband doesn't understand, he's a man, so I need someone to talk and I need someone to share. And you can just share your thought, your experience, your problem in the group. Sometimes it might help you. All right, so that you feel more motivated. You might feel that, oh, I'm not alone, there's a lot of mother out there also have the same issue with me, and you might feel more positive to continue your journey. All right, so basically that it's all the sharing today. So I hope that everyone can catch all the tip. Okay, the first tip is breast milk come in 3 stages. So remember, don't expect that you have a plenty of milk on the breast when you feed the baby in day one. Okay, so tip number two, finding right position for you is ultra important. So you need to make sure that you try a few positions so that you can fit the baby well. Tip number three, get the latch take practice. Okay, and all right, okay, get tip number four. Okay, Nursing a new arrival can be a full-time job. So breastfeed your baby on demand to make sure that the baby can feed well, okay, day and night, okay? All right, so that you can produce plenty of milk later. Breastfeeding should not be painful. So if you do have pain and if you do think that you do have problem in breastfeeding, find for help. All right. Don't get overly anxious about your milk supply. Always remember that you will produce enough milk for your baby. Okay, but you need to know what is the sign that the baby is getting enough. A well-fed mama means a well-fed baby. All right, love yourself so that you can love your babies better and get the support that you need if you do think that you need a support. And there's a lot of mother out there, there's a lot of counselor out there, there's a lot of consultant out there that are very helpful. And even maybe you are not knowing them, but they can help you very well. Okay, so that you can breastfeed your baby, you can give the best milk to the baby later. All right. Okay, Shamin.
Hi, thank
Mm,
you so much, Elpeni. That was a very, very informative presentation from Elpeni. So we have some questions from the viewers. So perhaps we'll just like address them first. You could
right.
answer their questions. One of the questions is not trying to remember who asked it, but they asked how can they boost their milk yield?
Yeah, all right. Okay. So basically, Madam Lit Chin Ling, okay, she's asking on how to boost the milk yield. Okay, right. So how to increase milk supply. Okay, there's a few things that you can do to boost up your milk. Okay, and a very common question that mommy are asking me is there's any booster, there's any milk booster, there's any pill, there's any tea that I can consume so that I have more milk. Okay, the answer is there's no magic pill, there's no magic tea, there's no magic milk. All right. So you cannot expect that. Oh, for example, you take a milk booster and the next day you have more. Okay. So you need to
Mhm.
always remember the concept of demand and supply. Okay. The more demand, the more milk that you let the baby drink, the more milk that you take out from the breast, the more milk that you will produce. So you need to always remember, feed your baby on demand, but you need to make sure that the baby is sucking correctly so that you transfer the milk better from the breast. Okay, if you with your baby, feed the baby more. If you are away with your baby, this is the tip to have more milk. Like if you be with the baby, feed the baby frequent. Okay, if you are a
Mhm.
working mother, pump your milk on schedule. This is the tip on how you can have more milk actually. Okay, because some other they thought that okay they let the breast feel full before they start feeding the baby so that the baby get more milk. This is not a good idea for you to keep doing it because if you always keep your breast full with milk, your breast will start sending a false signal to your brain to produce less milk. Okay, so to have more milk, you need to empty and clear the breast more frequent. Okay, all right, Shamin.
All right. Then the next question is flashed on the screen.
All right. So,
Now, how to relieve sore and engorged breasts?
right. So, Madam Chayin. Okay. So, for those mother who experience anguish and so breast, okay, basically this happen because the breast is full with milk. So if the mother having an engorged breast, so I always ask them this question first. Either the breast is touchable or even to touch the breast the mother already feel pain. Okay, with these two condition, if your breast is sore but you can still manage to touch and you still manage to massage your breast, you can straight away take a towel in the hot warm water that you can stand the hotness, put a towel there, okay, and apply the towel to the breast and start doing a massage, okay, simple massage. Okay, I will show some of the massage. Okay, my breast going down, so I need to take my breast first. See, all right, my breast rolling down just now during the session. All right. So you can just take a towel, okay, in a hot warm water. Okay. You squeeze the towel, the hot towel, just apply the towel on the breast. Okay, and you can just slowly massage. Okay, 1, 2, 3, 4, 5. And then from the side, 1, 2, 3, 4, 5. And then below of your armpit, okay, what you can do, you can just use your forefinger and slowly bring it toward your nipple. All right, 5 times. Okay. You are a breastfeeding mother, Shami. You always feel a pain here, right? So you can always,
Yes.
yeah, slowly do that, and you can just roll from your chest. You go down, circular motion towards the nipple. Okay, you can do this massage with a warm towel, or you can just stand under the hot shower. When you stand
Mm,
under the hot shower and do the massage with your soap in your hand, so it might be better. Okay, you can massage well. Okay, so after the massage, you can always try to hand express first. Hand express first the milk, because sometimes there's a block there that you cannot see, and most of the pump also cannot uh take all the block, so you can
mm,
always use your hand to just do the hand expression to make sure that the all the hole is clear, and you can start feed your baby. Okay,
mm,
but if your breast is very pain, is very sore, you cannot even touch, you cannot, so how you want to do a massage if you cannot touch the breast, right? So you can always put something cold first. Okay, you can just take a cold water from a fridge with few cube of ice, okay, and put a towel there and just apply to the breast.
what
Okay.
about a cold cabbage?
Yeah, cold cabbage. So all people they put a cold cabbage right on the breast. That one also can. Okay, that's the reason why God create a cabbage like that. The texture of the cabbage, if you really look on that, it's really look like a breast, right? So you just take one. Okay, that the cabbage that you put inside the fridge and put on the breast to just soothing the breast. But the only thing that you need to a little bit aware with cabbage is cabbage can reduce supply.
Mm.
All right, so you cannot put it too long on the breast.
Is
You
it
just,
only fresh or is just anything cold compress?
yes, anything cool actually. But
Mm.
uh, I have some issue with my Chinese patient who deliver because cool is a big no to them.
Yeah.
Eyes, big no to them. Okay, but you need to remember, if you feel so much pain, you put something hot there, the pain will be more. All right, so you need to make sure that you put something cold first. Okay, I know that your confinement lady, your mother will stare at you, but you need to tell them you are in pain. So if you are in pain, put something cold first before you do the massage. But if your breast is you can touch your breast, you can do straight away massage, you can just straight away do the massage and some hand expression and just let the baby drink from the breast. Okay,
Cool.
I
Thanks.
hope.
And the third question is it advisable to pump milk outright at night if baby don't wake up for a feed?
All right, so basically I will ask first, how old is the baby?
How
If
old is
Madam
the baby?
Chayan can wish okay, if Madam Chayan
Yeah, yes.
can answer me, how old is your baby? Because it's depend on how old is your baby. Okay, for a newborn baby, especially for the first 1 month, okay, if the baby is just sleeping throughout the night, we will ask the mother or we will advise the mother to wake the babies up for the milk. All right, because breastfeeding is supposed to be 8 to 12 times a day for a newborn baby. So because if they just sleep throughout the night, there's something wrong with your baby. Okay, because a jaundice baby,
Mm,
they always sleepy. They always fall asleep even they are hungry. So if you're having a newborn, okay, and the baby is sleeping throughout the night, you need to make sure that you wake the babies up. All right, to
mm,
have a feed on the breast. But if you have an older baby, for example, maybe Madam Chayan, a baby is more than 1 month, okay, and she noticed that the baby is not waking up at night to feed on the breast, okay. So first thing that she need to do, she can just try to wake her baby up to drink. But if the baby don't want to wake up and drink, it is good for her to just express the milk. This is just to maintain the supply, okay, to make sure that you have the milk longer on the breast. Because if you just sleep all the time throughout the night for a few months, you will have a supply issue later. Because I'm very sure most of the mother, they don't want to feed the baby only for the few months, right? They want to try
mm,
their best to feed the baby longer, so that to make sure that you can feed your baby longer. If the your bigger baby, maybe 2 3 month old baby, doesn't wake up at night already want to drink, you need to wake up and just express some of the milk to just give the signal to the brain that you still need milk for your baby.
mm.
At least one time you wake up.
Should yeah. I think should babies at let's say for she's almost 6 months. Should they
Okay,
still waking up at night for a feed or
it's
they
it's
should?
depend. It's depend on because baby are very individual actually. So it's
Mm.
depend on the baby. So if you feel that the baby is not waking up at night to feed on the breast, but the baby have a very good weight gain, good pee, good poo, so nothing to worry. But if
Mm.
your baby is sleeping throughout the night and the weight gain is not nice according to the curve, so there's something that you need to bear in your mind. Again, you need to
Mm.
look back.
Okay. All right. Thank you for the questions. So we did mention that we're going to have a quiz at the end of Elpeni's session. So Elpeni will run this quiz and you can help to spot the right answers.
Okay.
So the first question, when do mothers start producing milk? So the fastest answer will win the prize. When do mothers start producing milk? Do we have an answer?
Not yet. It's very
Is it too hard?
easy.
Too hard
Easy.
a question. When do mothers start producing milk? And I think we have our winner. Is it correct,
I
Alpany?
I don't see the
Second trimester.
yes. Second trimester is
Well done.
correct. During
Yay, correct.
the second trimester.
So the second question is, name one breastfeeding position. So out of the positions that Alpany has shared, name one breastfeeding position. Do we have an answer?
Yeah, faster, faster. Very
Fastest
interesting. Ah,
person.
yeah, yeah.
But still answering the first question. Okay, we have
Cik Dila.
winner.
Yes, good. She remembered the rugby ball.
Well done. Okay, here's the last question. What is one sign to know that baby is receiving enough milk? One sign that baby is receiving enough milk. Do we have? So one more. What is the one sign that baby is receiving enough milk? Do we have an answer from the audience? One sign out of all the signs that baby is actually receiving enough milk. We have the answers. And is that the correct answer, Alpini?
Okay, because I think no.
Wrong answer.
Okay, maybe we can
What
get the
about this
potential running
one?
to change of color.
Cindy? Is,
Yes.
is that the correct answer, Alpini?
Yes.
Okay, well done. So to our three winners, we'll drop us a message and we'll contact you about the collection of the prizes. So I think we're out of time soon and we need to wrap it up. I'm Charmaine and this is Medela live streaming series on Facebook. We've been talking to Elpeni Ramli. Thank you so much for taking your precious time out to join us today and sharing with us breastfeeding tips and how to actually start. So thank you, Elpeni. Any last few words you would like to share with our audience?
All right. Thank you so much to those who are joining the session today. All right. So even we already end of our discussion. Please share this video so that more pregnant mother are benefit from the sharing. More mother to be or more a breastfeeding mother who want to feed their baby can
Mhm.
learn more from the session, because I think it's very important for us as a woman to have some idea on how to start the breastfeeding correctly actually.
Mm. So, okay, I think Elpeni will be having one more session with us in this professional series. It'll be on 1st of August, if I'm not wrong. So she'll be sharing about myths about breastfeeding. Is that right, Elpeni?
Yes, but will be on 5th. I think
Oh,
it's on,
sorry, fifth.
yeah, yeah,
I got
but
the date wrong.
yeah, because Shumin is very busy with Medela now.
So it's on the 5th of August. So
Yeah.
if the viewers have any more questions about breastfeeding and breastfeeding tips,
Mm,
will join us on the 5th, and you could post your questions to Alpini. She'll be more than happy to answer these questions.
yes.
All right. Thank you so much, Alpini.
All right. Thank
See you
you.
again on the 5th of August.
All right.
Thank you. All right. So thank you, everyone. And thank you, our viewers, for watching. So we'll announce the three winners for the like and share right now. So the three winners are Chick Rose Soon, and Cindy Zhang. So for those of our viewers who are the winners in Malaysia, please get in touch with Medela Malaysia Facebook page, DM us, and we'll get in touch with you on the collection of your prize. For the winner in Singapore, Cindy Chan, please do contact us from our Facebook page, and we'll let you know when to collect your prizes. So thank you for your time for viewing, and join us again next Wednesday night with Dr. Chin. He'll be sharing about breastfeeding, how it supports good gut health. And do follow and like us on our Instagram and Facebook page for both Medela Malaysia and Medela Singapore. And you can also view these videos and the past few videos on our Facebook pages. So just do go and view it if you've missed it, and you can learn more from the sessions as well. So thank you, everyone. Goodbye, and I'll see you again. Bye.